We are looking into the fields of policy, innovation, which essentially it's R&D, engineering, and advocacy to figure out ways to be able to change current processes in healthcare and to lower healthcare costs in that process, whether it's a technological solution or if it's a process solution, or if it's a policy solution. With healthcare and with the kind of the collision of technology and with healthcare, both are going to kind of different streams. And the main focus from a policy perspective is safety and efficacy, safety being paramount. And to be able to recognize the advances of technology with the current state of healthcare, I think there's a lot of challenges there, and a lot of getting up to speed from a regulatory perspective. And so we do have an office in Washington, D.C., where we're working and collaborating with partners or organizations such as the FDA and the FCC and other organizations to be able to provide an understanding of where we see from a non-biased neutral perspective where we see wireless health and mHealth and how that can actually impact and lower healthcare costs and actually develop good policy based on that notion. We're looking to be able to provide that perspective that sustainable mHealth and wireless health, the real core value proposition from a policy perspective is really lowering healthcare costs, and that can be enabled from a policy perspective, but also from a business perspective. I think there's enough advocacy groups. I mean, you can see the stakeholder community here. It's large enough where there's enough advocacy groups, and not just from one sector. It's multiple sectors because everyone has a viewpoint, everyone has perspective, and oftentimes there are more similarities than differences. And so I think the power is to be able to bring those perspectives together, and abide by how regulation and policy is developed in terms of guidelines, in terms of framework, providing that to the FDA and others, and be able to get the message out.